Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who suffers from chronic otitis externa, and as part of their otitis externa they get a collection of dead skin and infected debris that occludes their ear. In the last, I believe, 6 months, they've had to have their ears cleaned out on 3 separate occasions. This is the first time the patient's visited myself, and they advised that their symptoms first commenced around 4 years ago. Now, if you've been watching a lot of my recent videos, I discussed the link between very dry ears and dead skin collecting in the ear and menopause. However, this patient was too young for that. So it's one of the questions, one of the things I discussed and explained that it could be a potential cause. The patient has undergone a lot of ENT investigations as to the underlying nature and cause of her otitis externa. However, there's no definitive diagnosis given, and sometimes you can't. It's just very difficult to understand why all of a sudden the patient is experiencing this build-up. One of the things the ENT consultant did potentially say was a cause was that at the same time the patient is suffering from a lot more stress, and stress can do many things to the body. Not least it can secrete cortisol, which is the stress hormone, if you like, and it is known that this can be secreted within the ear canal. So that's one potential cause. In terms of managing it, now her main symptoms is extremely itchy ears, and again she's tried all the prescribed ear sprays. There is an antibiotic spray that does give her some relief, but because it contains an antibiotic they can't overprescribe it. So the patient's at a bit of a loggerheads, and it's a bit of a conundrum for her. So I'll explain what we're doing right now, and I'll explain some of the advice I gave to the patient to see if that can help her. Now, whenever you've got this consistency of dead skin and debris, it's really hard to suction because the consistency is like mashed potato. Again, if you've been watching my videos, you know I like to make food analogies. Sorry if anyone's having their dinner or breakfast or lunch, depending upon where you are in the world when you're watching this. And therefore, I've really dosed the ear initially with olive oil spray, but then I didn't find that to be as effective. I've reverted to sodium bicarbonate drops, and more recently I've been suctioning the ear whilst the drops is in situ. But on this occasion I just left the sodium bicarbonate drops to let it set and collect at the base of the ear canal for around 3 or 4 minutes before tilting the patient's head the opposite direction to drain some of the excess. And as you can see, what it's done, it's helped to bring together this dead skin, debris. So it's not actually earwax, this is just infected debris and dead skin formation. Now, they did advise on the last occasion that they had it performed, or the last 2 occasions, sorry. They went to a high street place where they also removed wax, but they were advised that they didn't remove all of it because the bit on the eardrum was too complex. So it's likely that this has been there for a while, and the patient was asking me, she was concerned why was it so regular that she was having to have her ears cleaned. And I did explain, well, sometimes that can be the cause, and that's just the way, unfortunately, things are when people suffer from this. And I've got a few clients that do have to just have it regularly cleaned, unfortunately. But now that we've cleaned all of it, we can now monitor how long it will last, and hopefully she won't have it removed as regular as she currently is. So you can see the eardrum there. I'm just using a fine end suction probe just to remove some dead skin just from the trench, the inferior recess. There's a little trench basin near the foot of the eardrum called the inferior recess. Now there's a bit of keratin just to the left there. It's half on the anterior canal wall. It's in the anterior recess, that part of the ear canal, and some of it is on the eardrum now. Going to be gentle. I did touch this, and this is a bit, it wasn't going to budge, so I stopped, because in order for me to peel this, I have to manoeuvre the suction probe very close to the eardrum, and we don't want to perforate the patient's eardrum or bruise it or do any trauma just for the sake of removing a little bit of debris there, which is not going to affect her hearing at all. Now, you can see this dead skin that's lining the ear canal. It's a really thick skin the patient had, and it was really, really tough. Now, I removed as much skin as possible. Some of the skin just wasn't ready to be removed. And remember, I've already dosed the ear with drops. So I'm just going to peel away as much as I can. And whilst I am, I'm just going to explain some of the treatment options that we've discussed. So the patient is already aware to avoid water in the ear. It's something that the ENT consultant advised them from the offset. So the patient uses a bit of cotton wool and a bit of Vaseline around the edge just to create a watertight seal when they go showering or for when they go swimming, for example. They, as I said, use Otomize. Otomize is an antibiotic spray that contains an antibiotic called neomycin. It also contains a steroid, dexamethasone, which is an anti-inflammatory. It reduces any inflammation within the ear canal. And it also contains acetic acid. So acetic acid, your ear should be slightly acidic in pH. And when you've got otitis externa, so otitis externa is an umbrella term for any sort of inflammation or ear infection of the outer ear canal, so from the external ear itself, the satellite dish externally, the ear canal and the outer layer of the eardrum, that's the outer ear. So any inflammation or ear infection of any sort, so it's an umbrella term as I mentioned, we call that otitis externa. So acetic acid, so that your ear canal should be slightly acidic in pH, and when you've got otitis externa, the pH level turns slightly alkaline. So what the acetic acid is, it's a vinegar spray, it just reacidifies the ear. So I think the average pH of one's ear is about 5.4 pH, and then acetic acid is really, really acidic, it's about 2.3, so it just helps to reacidify the ear, and that can help. But so Otomize contains those three ingredients, acetic acid, an antibiotic, and a steroid. That has to be prescribed, and because it contains an antibiotic, doctors are very understandably so reluctant to overprescribe antibiotics, because then we can build a wall of immunity against these. The bacteria, should I say, it can become resistant to the antibiotic, which long term is going to cause issues. Therefore, I did suggest it's a spray you can get over the counter, just an acetic acid spray. You can get that from over the counter. Haven't got any antibiotic in, but the patient said that alone it doesn't help. They've tried that. They regularly use. They were also advised to use olive oil on a regular basis, just to help moisturise the skin, which is advice that I would give as well. But again, the patient doesn't feel it helps. And they obviously, when you scratch your ear because of an itch, and it's easier said than done just to not scratch it. I understand that completely. When you scratch your ear canal, you're damaging the outer layer of skin cells. You're grazing it, and when those skin cells regrow, the process of growing these dead skin cells again, it's actually quite itchy in nature. So by scratching your ear, you're almost guaranteeing your ear another itch in your ear 2 to 6 weeks, depending on how long it takes your ear to regrow those dead skin cells. So you can see I've just used sodium bicarbonate drops just like in the first ear, and this is a big plug, and we're just going to wriggle it through the entrance. We do manage there, and if you carry on watching, you can see we do remove a lot of dead skin off the ear canal as much as we can. The skin here wasn't as strongly adhered as the original left ear, the first ear. So what I've advised the patient to do is just to reiterate everything that they're already doing. So keeping the ear dry, don't poke in the ears, avoid, as I said, avoid water in the ears, and instead of ear roll, an olive oil spray, there's something called ear roll swim in the UK, and I'm sure you can get it around the world as well. And it's an olive oil spray, but it also contains tea tree. And tea tree oil is known to have antimicrobial properties. So if there is any bacteria or fungi or viral load in the ear canal, tea tree is a natural substance that's known to have some benefit there. And I had some ear roll swim in the clinic, so we just sprayed that in the ear, and immediately they felt it just calm their ear down, because despite removing the wax and the skin, they still found the ears to be extremely itchy, and so it seemed like the tea tree did help, but it's very early days, and I did provide realistic expectations to the patient. They've already been seeing ENT, and ENT, as I said, have done exhaustive examinations, investigations now. the next step would be is to potentially see a dermatologist regarding this, have some further allergy testing potentially, but they're going to see how they fare. There is hope and a chance that, if not completely this condition being alleviated in the future, that maybe the itchiness is less severe, and also the frequency by which the ear canal gets clogged up with the dead skin and debris is increased, so they don't have to have their ears cleaned out as regularly. So it's just a monitoring process now. So the first time I met the patient, I could see it was really affecting them, and they were kind of hoping that I had a trick up my sleeve and something that some advice that I could completely eradicate this for them. And fortunately, that wasn't the case. And you can just everything the ENT, it's a local ENT who I know very well, and everything they were advisors, the things that I would advise to my patients. So we're just gonna the only added treatment option I can really provide them, what they've already used and have used, is this olive oil and tea tree oil combination, and we'll see how that goes. So you can see the eardrum at the distance, just some dead skin at the bottom. We are going to manage to peel the majority of this. Just using the fine end suction probe, just lifting it up. So this is dead skin that it hasn't shedded by itself. It's just this layer of skin will just remain in the ear canal, then they'll get another layer, then they'll get another layer on top of that. And before you know it, they'll have a plug of dead skin, which can lead to a condition called keratosis obturans. So keratosis obturans is when this skin eventually forms a plug, and this plug can expand so much it widens the ear canal, and it can cause erosions within the ear canal. It can lead to also secondary conditions such as a canal cholesteatoma, which can be quite serious, or necrotizing otitis externa, and that's when the ear canal gets so infected that it can start spreading across so the bone that encases the ear is called the temporal bone. So you can imagine this, if the part of the bone gets infected, necrotizing otitis externa is when this infection of the temporal bone, it spreads right across the bone, and it can then go upwards towards the brain, because the brain's just top of the skull itself. It's just on top of the ear. So it's always good if you do have a history of ear infections and you've got any concerns about your ears, and just do visit a specialist just to have them examined, just to make sure everything's okay, and they can offer. It's better to get treatment sooner rather than later. Today's been a really, really tough day in the office, actually. I've had a lovely patient arrive from Liverpool today. So Liverpool's I think it was a 2.5 hour journey each way, so 5 hours. Young child, really, really severe blockage, and I'll have to have a look at whether they gave approval for their procedure to be uploaded. We have a consent form, and there's a little tick box. I will check, and if so, I will upload that. I didn't get time to check immediately after today. Just been so busy, but spent about 45 minutes, I think, removing that from both ears. And they had a wax buildup that was there for about, I think, the patient's 11 now, so they said 6 years ago, and they were just advised to continue to use drops. It'll get better and better. And then lockdown happened, and then one thing leads to another, and they'll be trying to find a clinic locally where they treat children and paediatrics, but not a lot of audiologists, at least in the UK, actually do offer treatment for children, because it's just a lot more complex. So that's as simple as that. It's a lot more difficult. And I've got another child coming, I think, from, I'm not sure where, but they sent an email inquiry. We've got to get back to them tomorrow. Got it off the email inquiry, received it after work. I think they live 3 hours away. And again, similar problem. The child's a bit younger, but there's no one local that can offer the service. So anyway, we spent the best part of an hour, and it was tough. It was a challenging one, because that earwax became almost a fixture and fitting of the ear. That's what I was explaining. It was so impacted, and it just became part of the ear. Bless her, she was amazing. She was really still. We managed to remove it completely. And if they're watching, because I do watch the videos, I hope they had a safe journey back. At one stage, I was worried I wouldn't be able to remove it from the second ear. It was just a humongous piece, and I was just like, oh, they've travelled all this way, and I'm sure if they came back with a bit of drops use, I would have been able to do it, but I wanted to get it out for them today, and we managed to do it, so I was really pleased. And then another patient who's had a blockage for 10 years, similarly, it was really impacted. But yeah, it's been a good, challenging day, which I like. Well, I hope you enjoyed that video, guys. Keep well, take care, and remember, be nice, be kind. Bye.